Alicia Williams is a busy woman. She has 2 sons, holds down 2 jobs, and is working toward her degree as a registered nurse. But studies, work, and children got short shrift when Alicia got her periods.
I couldn't go out to my son's games and stay for long periods of time because I would have to come back and use the bathroom to change, and I couldn't go to work. If I do go out, I have to pack wipes. I have to pack 4 or 5 sanitary napkins, the large ones, plus tampons, and it was expensive. Having a heavy menstrual period, I can't do as much as I would like to. You know, it knocks me down for a couple of days.
Alicia struggled with a condition called heavy monthly bleeding, or HMB, for years. Then she enrolled in a clinical trial for LYSTEDA, or tranexamic acid tablets, a prescription medicine used to treat women with HMB.
Heavy menstrual bleeding can have a profound impact on women's lives. They will not be able to do as much as they'd like physically. They'll avoid social things, won't go out with friends, won't do things with their husbands.
The condition affects millions of women in this country, but only 11% seek treatment, in part because surgical therapies like hysterectomy, hormonal treatments, and oral contraceptives are not right for everyone. For Alisha, LYSTEDA offers a non-hormonal, non-surgical option to address the challenges of heavy monthly bleeding.
I only take LYSTEDA when my menstrual cycle is here, so it's easy versus having to take something every day of the month.
In clinical trials, LYSTEDA reduced menstrual blood loss throughout all cycles studied, beginning as early as the first cycle of treatment.
I'm able to sit up with my kids and help with homework. I'm able to sit at that nightly baseball or basketball game. I'm able to go to work and function on my first couple of days of my menstrual cycle. There's a lot of people out there that have the same symptoms that I had with the heavy menstrual bleeding, but if they give LYSTEDA a chance, I think it will be an amazing experience for them.
LYSTEDA is a prescription medicine used to treat your heavy monthly period, menstruation, when your bleeding gets in the way of social, leisure, and physical activities. LYSTEDA does not contain any hormones and is taken only during your period. It does not treat premenstrual symptoms, does not affect your fertility, and cannot be used as birth control. It does not protect against sexually transmitted diseases. LYSTEDA has not been studied in adolescents younger than 18 years of age. You should not take LYSTEDA if you currently have or have ever had a blood clot, have been told you're at risk for having a blood clot, or are allergic to LYSTEDA or tranexamic acid. LYSTEDA can cause serious side effects, including the risk of serious blood clots may be increased when LYSTEDA is taken with hormonal contraceptives, especially if you're taking higher than your normal dose of birth control, are overweight, or if you smoke cigarettes. Risk of serious blood clots may also be increased if you take LYSTEDA with medicines used to help your blood clot, or some medicines used to treat leukemia. Be sure to tell your healthcare provider if you take any of these medicines. Stop taking LYSTEDA if you experience any eye changes, and promptly report any eye problems to your healthcare provider. If you have an allergic reaction, have shortness of breath, and your throat feels tight, stop taking LYSTEDA and get medical help right away. The most common side effects of LYSTEDA include headaches, sinus and nasal problems, back pain, pain in your abdomen, pain in your muscles or joints, anemia, and fatigue. If you notice a change in your usual bleeding pattern that worries you, or your heavy bleeding continues, contact your healthcare provider right away. This may be a sign of a more serious condition. You're encouraged to report side effects of prescription drugs. Contact Ferring at 1-888-FERRING or call 1-800-FDA-1088 or visit fda.gov/medwatch. Please see full prescribing information for LYSTEDA.